Hello everyone, I am Dr. Kaustav Ghosh, a hematologist from NRS Medical College, and today we will be discussing about what test to be done for a case of anemia. As we know, anemia is characterized by decrease in the hemoglobin as per the specific cutoff as per the age and sex, and it is a major health problem in India. So first of all, we have to do a complete blood count along with the peripheral smear. In this in this CBC, we have to look at the hemoglobin. Along with that, the hematocrit, the RBC indices, that is the MCV, MCH, MCHC, the RDW, that is the red cell distribution width, and the RBC count. If the MCV is less than 80, it is called microcytic. If it is 80 to 100, it is normocytic. If it is more than 100, then it is macrocytic. So likewise, we have to proceed. Along with the CBC, we have to do a reticulocyte count also in all the cases of suspected anemia. If there is a microcytic picture, then the common causes are iron deficiency anemia, thalassemia, anemia of chronic disease. So for iron deficiency anemia, we have to do iron profile consisting of serum ferritin, iron, TIBC, and the transferrin saturation. And to rule out thalassemia, we have to do a hemoglobin HPLC. And for the anemia of chronic disease, the organ function evaluation, urea, creatinine, LFT, and the disease status of the patient should be looked into the account. If it is a macrocytic picture, then a serum vitamin B12 and a folate level should be done. In cases of alcohol intake and hypothyroidism, also a macrocytic picture can be seen. So these two should also be ruled out. If it is a normocytic picture, then we have to see whether there is reticulocytopenia or reticulocytosis. In reticulocytosis, it is commonly due to acute blood loss or due to hemolysis. And to rule out hemolytic anemia, we have to do serum LDH, indirect bilirubin, and a direct Coombs test. If there is reticulocytopenia, then we have to rule out either anemia of chronic disease or aplastic anemia. So in aplastic anemia, generally along with reticulocytopenia, multiple cell lineages are involved. So along with anemia, there would also be neutropenia and the thrombocytopenia. So by this approach, we can diagnose the common causes of anemia. And so when a bone marrow examination should be considered in anemia, if all the above routine tests are normal and it is a case of suspected pancytopenia, then the bone marrow should be done. If we are suspecting any acute leukemia or any lymphoma infiltration or any other suspected leukemia or any lymphoma infiltration or any suspected malignancy based upon the peripheral smear or the history, then the bone marrow should be considered. Also, if we are suspecting any storage disorder, then also a bone marrow should be considered. Thank you.